American Health Panel now recommends all adults under the age of 65 get screened for anxiety. The U.S. Preventive Services Task Force says it is especially important for pregnant people and those who gave birth within the last year to be screened. Dr. Gbenga Ogedegbe is a member of that task force, and he joins us now to talk about it. Doctor, thanks so much for joining us. So why now?
Well, that's a good question. Thanks for having me, and good morning. The task force does requests for nominations for topics. And when we receive those nominations, we accept them. The topic for anxiety was nominated, and we prioritize that topic because of its public health importance, particularly at this time with the increased focus on mental health in the country over the past few years.
So I'm curious about, how does a doctor screen for anxiety? I know that when I go to the doctor, right, for sort of my yearly checkup, there seems to be some general questions in regards to depression. How are you feeling? That sort of thing. But it's like 2 or 3 questions, and then that's it, if I answer them correctly. How do you screen for anxiety?
So the screening for anxiety is typically done through a questionnaire. There are tools and whose accuracy have been vetted, and they're valid and reliable. And basically, they ask several questions, and if somebody screens positive for that, what then needs to happen is there should be a follow-up assessment that will then confirm the diagnosis of anxiety disorder. So it's through the questionnaires that the screening occurs.
I'm curious, doctor, do people suffer from anxiety but actually not know it unless they're sort of asked direct, pointed questions?
That's a good question. A lot of people may not know that they have anxiety disorder. Now, that said, it's important to understand that, there are signs and symptoms of anxiety. The key issue that we try to address with the panel is to review the evidence for whether or not, if we screen people without recognized symptoms or signs for anxiety disorder, whether or not that is beneficial. So because we know that people may not know that they have anxiety disorder or not.
So Dr. Emery said something interesting to me, and I hadn't thought of this, that there is a difference between when someone feels anxious and an actual anxiety disorder. Can you help me distinguish the two? I mean, because my first thought was, well, I could have used this when I was 12 or 13 years old, and I was, moving from town to town and going to a new school and being that new kid. I felt very anxious.
Which is a reasonable reaction to that kind of upheaval in your life. But doctor, I guess, people who suffer from anxiety disorder, I guess sometimes it's a reasonable reaction, but sometimes it's not.
So the key thing to understand here is that it's okay to worry. That is a regular process. There are several reasons why we worry. Anxiety disorder, though, is when there's excessive concerns, excessive worries that actually interferes with your normal daily activity. So that excessiveness of concerns and worries is actually what we call anxiety disorder. And there are different types of them. There's generalized anxiety disorder, where there's no specific reason for the excessive worrying that happens. There's phobia, there's panic disorder. People panic over things that ordinarily won't be an issue for normal folks. So while it's important to understand that, we do worry, life happens, it is excessive worriness, excessive concerns, and that actually interferes with your normal activities. That's when you talk about anxiety disorder.
So, doctor, the cynic in me is gonna ask you a question. I feel like maybe 10 years ago, the sort of modern day mental health plague was depression. And what can we do about depression? We should all exercise more. There's these antidepressant drugs that have come out. And now we have a host of anti-anxiety drugs that are available. And the cynic in me wonders if anxiety has become like the mental disorder du jour, and there are drugs to treat it, and so we've just sort of shifted our energy to a disorder that may or may not be on the rise.
So that's a very good point. The key thing to appreciate here is that while it is true that some of the symptoms that we have with depression, you can have a similar symptom with anxiety disorder. it's important to really appreciate the fundamental difference in them. We think that because of the increased focus on mental health in the nation, and because really, frankly, we're seeing that the lifetime burden of anxiety disorder is going up. So it's important to appreciate that they're two distinct diseases. And so while I understand that people are concerned about this, the screening in people without symptoms or signs of anxiety disorder is really hugely beneficial. And we recommend that people should be screened in their primary care practices regularly.
Thank you, Dr. Gbenga Ogedegbe. Thank you so much.
Thank you for your time.